So today I gave a talk on novel biomarkers of response to immunotherapies, and we have, in collaboration with Dr. Amit Verma and Mani Mohindru at Roshan Therapeutics and the Albert Einstein College of Medicine, discovered a new and exciting biomarker for response to CAR-T in the bone marrow and blood of patients with multiple myeloma. This is a myeloid-derived suppressing cytokine called S100A8A9, and indeed our studies suggest that an elevated level of this molecule predicts for poor outcomes in patients, and along with in vitro studies, we have actually tested an antibody that inhibits this cytokine and in fact restores CAR-T functionality. This is indeed exciting, as we think this can be combined with CAR-Ts and even bispecific antibodies to improve outcomes for patients with multiple myeloma.